Hello, my name is Kayla. I'm going to be talking about coping, resilience, and social support. Here we go. So, what is coping? It's the thoughts and behaviors used to manage the internal and external demands of situations that are praised as stressful. And some of the characteristics is a set of response occurring over time by which the environment and the person influence each other. And coping is Buddhist, meaning that it happens in a long period of time. It doesn't happen one day to the next. What affects coping? That's going to be personality because everybody reacts to things differently. A negativity, stress, and illness. Because if you're so negative, you respond to something so strongly, you receive stress, and then there's more likelihood of illness. Then there's positivity and illness because if you're more positive, you have lower levels of stress indicators. And when people feel positive, their moods are affected positively, their stress levels are lower. So the psychological resources is optimism. Optimists have better psychological stress profiles on indicators such as cortisol, blood pressure, and inflammation. Psychological control, it's the belief that one can determine one's own behavior, influences one's environment, and brings about desired outcomes. And this is either with your own self that you can do this, or a collaboration with family, friends, or even a medical practitioner. And then self-esteem is associated with lower levels of stress indicators such as the HPA axis activity. Resilience is how quickly somebody can recover over a difficult time. And what promotes this resilience? It's a sense of coherence about one's life, a purpose, meaning. Some of these coping styles is approach avoidance, problem focused and emotional focused coping, emotional approach coping, and proactive coping. Coping is also affected by external resources such as time, money, education, and job, not just internal resources. What are the coping outcomes? Health psychologists usually assess whether the following outcomes have been achieved, such as emotional equilibrium, positive self-image, but another often used criteria of successful coping is how quickly people can return to their pre-stress activities. Some coping interventions is meditation, expressive writing, self-affirmation, and relaxed training. The most vital of all protective psychosocial resources is social support. I found research on the examination of social ties and survival after breast cancer diagnosis, and the results that those who were socially isolated before diagnosis had a subsequent 66% of increased risk of all-cause mortality and twofold increased risk of breast cancer mortality compared to the women who were socially integrated. The conclusion is that socially isolated women had an elevated risk of mortality after diagnosis due to lack of access to care, but specifically because of the lack of caregiving from friends, relatives, and adult children.